Good afternoon and welcome to Living Well with Adena. I'm Dr. John Gabus, Medical Director of Community Partnerships. So glad that you could join us on this beautiful fall day. Our old friend, the coronavirus, is still with us, unfortunately, and I do have some new information about pediatric vaccinations. And these are the Pfizer vaccines that are approved for children age 5 to 105. So they're available for 5 to 11-year-olds. They were previously approved for 12-year-olds and above. There are same-day appointments available at Adena Pediatrics Monday through Friday, 8 a.m. to 7 p.m., Saturdays 8 to 12 in the morning at Adena Pediatrics, which is in the Adena Medical Office Building on the main campus here in Chillicothe. You can call 779-4300 to schedule an appointment. And if you have a child that goes to Adena Pediatrics, you can also get that booster at a regular well visit or a checkup. So great news for children ages 5 to 11. Adena Pediatrics has the Pfizer vaccine, 8 in the morning until 7 p.m. Monday through Friday and Saturday mornings. Call 779-4300. Okay, great news. All right, we have a very special guest today, and I want to remind our viewers that if you have any questions, please put them into the chat or the comment section, and we'll get to those. I'd like to introduce Jamie Easterday, who is a nurse practitioner with Adena, but she was the founder of the Hope Clinic of Ross County, along with other friends and professional colleagues. And we're here to talk about the Hope Clinic, specifically about a very new, very exciting service that's being provided by the Hope Clinic. So Jamie, why don't you tell us a little bit about yourself, how you ended up as a nurse practitioner and why you do what you do?
Well, I've been a nurse for 24 years. I've been a nurse practitioner for 8 years, and I work currently in internal medicine at Adena. I'm also a wife and a mom. I am one of the founders of Hope Clinic of Ross County, but one of many. There were several different people that came together for the community. Once we had said that we want to start this clinic, and which was back in about 2010, whenever we first brought the idea we wanted to start one. There was several people from many different churches, many different associations that came together and wanted this to start, because I don't know if you remember, back at that time there was a recession. Mm-hmm. And during that recession, many people were losing their jobs, and along with their jobs, it was losing their insurance. And many people were deciding, I'm not going to pay for health care, I'm going to pay for my rent instead, because they had very few resources at that time and no choices for free health care at all. So we just seen an abundance of this. We were seeing it over and over again. Myself and Lana Urig, who was also a nurse at the hospital, and too many times we've seen people's health go by the wayside because they couldn't afford their medications. They couldn't afford going to the doctor's office. So we both had it laid on our heart that we wanted to start up a free clinic. We went to our pastor, David Dean, who actually kind of giggled at us and said, "Where are you girls going to get this money to start up this free clinic?" And we said, "God will provide." And we prayed, and God provided. And He provided all the people, many different professionals, doctors, many people in the community that if it wasn't for them, we wouldn't have been able to move this forward. And thank goodness, God put all the people in the right spot to be able to start this free clinic. So in 2012, we then started up the Hope Clinic, and we started up at the time up in Central Center, where the family social services area up there, that's where we started originally, but now we have our own space at 610 Central Center.
So that was in the old county services building,
yeah,
on Western Avenue there.
Yeah, yeah.
But now you're at, what's the address?
610 Central Center now.
Great. You know, when you drive by that opening, it's such an unassuming door. You know, when you look at it, it looks like looks like any entrance to any other business, but I bet behind those doors miracles happen.
Yes, many miracles have happened. And like I said, anytime that we've had a need, we've seen that there's a new service that we need to bring to our patients, and we're seeing something occurring over and over again. We have prayed, and it's come about. So every single time that there is a service that is needed, we have seen miracles happen. We've seen, when we need more volunteers, they come about. We've also seen times that there's been patients that have come in, and we were concerned, they may have something critical, cancer or any other diagnosis, and because we were there, they've been refused care by other healthcare facilities, and we have put them into the right place with Adena Health Systems and been able to take care of their cancer. And many of them have come back to us and said, we're cancer free because of you, because you helped us to be able to get into the right doors to be able to help us. They don't know about HCAP. They don't know that they can actually qualify. They think they make too much money.
Mm-hmm. What is HCAP?
HCAP is like a charity care that Adena will provide, and we will get them the forms and we get them the appointment so they can get the free care or discounted care through Adena Services.
Sure. So those folks were without health insurance and were without hope necessarily to getting their medical problems solved, and the Hope Clinic was there to take care of them in their time of need. That's amazing. With building this up from the ground, you started with medical services. What all services did you provide at the beginning, and what has expanded or developed since that time?
Since then, we would see a need. One of the needs is, I remember very early, we were trying to teach patients about diabetes and how to eat. And we had several patients that said, I don't even know when my next meal is going to be here. And so that's when Mobile Food Market came about. So we partnered with Mobile Food Market, and every other Monday we have a huge truck that comes. Now it's located at Centerpoint, but they come and they unload a very large amount of food, and they feed anywhere from 200 to 300 people through this program. And it's healthy foods too, so they can help take care of their diabetes. Then we also seen that there was a need for vision. People were having difficulty with their eyes. So we have a vision program now. You fill out an application and we can get patients that qualify, we can get them free eye exam and free glasses. So we have that program also. We also seen that dental was a huge need. People don't realize how dental health can affect the rest of their body. It can affect your heart. So we then came about and asked the dental community if they wanted to start up a dental clinic. Many different dentists came forth. Unfortunately, we didn't have a leader, but we prayed, and Melissa Ward came forward, and she started up the dental program, and she had a lot of contacts within the dental community, and she was able to get a lot of different people together. So with that, we started up the dental clinic and been able to help hundreds of people through that program.
Wow. So that's, I know that people may have health insurance, but the dental component of that may not either be in existence or it's very limited. What type of equipment was needed to set up a dental clinic?
Well, you can't pull a person's tooth if you don't have a Panorex machine. And a Panorex machine, if you know what it is a very large machine. If you go to a dentist's office that kind of goes around your mouth and it takes pictures. Well, we didn't have one of those, and they're not cheap either. So what we did was we actually, we prayed about it, and it was within a week. We had 2 different churches coming forth and asking us if they could give us money, and $40,000 we had for that machine. So it was incredible, and without that machine we could never have started the dental clinic, and we was able to start it. We was able to start the dental clinic because of that machine, and because of the community and how people came forth and helped us out.
So I know that there's something very new that's at the Hope Clinic, and that's a community charitable pharmacy.
Yes.
And I know that even patients with health insurance who have prescription coverage, there are still huge gaps in what they're able to afford. So can you talk about how you developed the idea of having a charitable pharmacy, and how did that come about, and why is it such an important addition to the Hope Clinic?
Well, we always had a little small clinic pharmacy, but we didn't have very many medications at all. And with the addition of the charitable pharmacy, we're able to help more people. And the reason why the charitable pharmacy came about was because myself, and I know many other providers in in our offices, we actually seen people that needed medications, but they would come back to us after we would prescribe them, and they'd say, this medication is going to cost me $150. This medication is going to cost me $250. And people that are on a budget, they can't afford that kind of medication or afford that cost for their medication. So what we have done is we have started up a charitable pharmacy. We are the 5th charitable pharmacy within Ohio. If you look at most of the larger cities, Cincinnati, Columbus, they have charitable pharmacies. But we have one right here in little old Chillicothe. We have one in Ross County. So, and we are open to all other counties surrounding us, and we do not close our doors to anybody that's not in our area. But it's a really neat program. One of our major providers through this is called Serum. And instead of throwing their medications away, the blister packs that they have at the nursing homes, whenever a patient no longer needs their medications, instead of throwing them away, they recycle them. These medications haven't been touched, so they recycle them and they give them to us. So that's one way we get our medications. Another way we get them is some other places. So far, we haven't had to spend any money on any medications because they're all donated through these companies, and it's really great. Now we will get to a point where we are going to be reordering, and that's where we do have some different grants that are helping us. But I'll tell you, I want to go back to why we started this. Somebody came to us. We had always thought it'd be a great plan, and we have actually visited the charitable pharmacy up in Columbus, but we just knew it was just a huge project, and whether or not we wanted to take on it, it was going to be very difficult. So Melanie Loftus, she's actually a pharmacist at Sam's Club. She came to us and she goes, would you guys be interested in starting up a charitable pharmacy? When she was in college at University of Cincinnati, she actually went to the charitable pharmacy down there and she trained, and she loved it, and she knew that's what she wanted to do. She also had an aunt when she was younger that was in the hospital and ended up very critically ill because her aunt could not afford any of the medication, her diabetic medication, so she ended in the hospital and didn't tell anybody, and that broke Melanie's heart, and she didn't want anybody else to suffer like that and go without their medications. So Melanie came to us. She had a plan that she had written all out. She came to us very nervous and said, I want to present my plan to the board, and she did, and she didn't need to be nervous because we were so happy she was there, and just it was an answered prayer. And she came to us and she gave us this, and we were just wowed. And she told us what the budget was going to be and everything. And we said, yes, we want to start this. So it's taken about a year to get it all planned out. But we just opened up our doors on November 1st, 2 Mondays ago. So, and I've personally sent some medications to this pharmacy for my patients because I've got patients that can't afford their corticosteroid inhalers. They end up in the hospital multiple times because they don't have their inhalers. They end up being hospitalized because they can't afford their inhalers. I've got a couple of diabetic patients that can't afford their insulin. I've sent them there to get their insulins, and they get it for free. And then I got a patient, I really want him on Jardiance because of his heart disease. He was able to get Jardiance. So those are just some different things. Now, to be a patient of the charitable pharmacy, you can have insurance. You can be uninsured or you can be insured. You have to be under the 300% poverty guideline. Yeah,
so that most of us don't have a clue what that level is. So do you have any kind of ballpark amounts?
So an income for a family of 3 can be about $65,000. A family of 5 is about 105,000.
Wow.
So it's a pretty high. That's pretty high. So it's your middle class families that, you know, they have these insurance. They have insurance, but they have really high deductibles. So so that's the ones that we're, you know, wanting to help.
Sure.
And we want to make sure that they don't go without their medications.
Yeah, I have a personal connection with the cost of insulin. I have a sister-in-law who had to split her doses or take less so that she could stretch it out because she couldn't afford medicines. And this is going to be a lifesaver for many of these folks, I'm sure. Okay.
Yeah.
So what are the hours of the Charitable Pharmacy?
As of right now, it's on every Monday night, except for major holidays, of course. If major holiday falls on a Monday, it's from 4 p.m. to 8 p.m.
So the Hope Clinic is open from 5 to 7, but this is open an hour before
An hour
and an
after.
hour after.
Yes.
Okay. All right. So the work that you're doing is so critically important to the people who have an economic barrier to health. Talk a little bit about how your faith led you here and how your faith kept you going and what the impact was on your faith life and maybe some examples of some volunteers on their faith life.
Oh, yeah. So volunteers do not have to be affiliated with the church or be claimed as a Christian at all or any kind of religious affiliation at all. So, but we've seen a lot of volunteers that have come and they've seen the miracles that we've witnessed. And when they come, their faith has increased. And it gives them a sense of purpose too. We have a lot of people that have retired and they're from the medical field or they've retired and there was a receptionist or something and we can use their help. And they have now a sense of purpose and they look forward to Monday nights because they can help us. But we've seen a lot of people that have not had any faith and, you know, don't, and they have become, you know, Christians and it's been a great thing. We have a lot of great people that come and they volunteer and they're just great people. Myself, I have seen so many miracles happen every single time that we have met a barrier, like the Panorex machine. Myself and other board members have just been blown away how we had that money within about 2 weeks. We had the money to cover that. So, and there's only one person or only one being that could ever make that happen, and that was God. Because $40,000 just doesn't drop in your lap, and that's basically what happened. We didn't fill out any grants, applications. We didn't do anything. It dropped in our lap. So what it does is every single time I feel like, God, if you want us to move forward with the service, you know, let us know. But if you want it to stop, let it stop, because we don't want to make our own plans. This is your plans. This is your ministry. This is your clinic. And every single time that we have ever had a need, he showed us that he wants us to move forward with it. And there's been times when we've prayed about things and it hasn't happened, and that's assumed that God does not want that to happen. He doesn't want us to move forward. This is his ministry, and it's all about him. It's about serving him, and it's about being the hands and feet of Jesus. So we always want to make sure that we always remember that, you know, pray first and then we receive or not receive.
I've come to understand a phrase, and actually it's from the organization that has the Charitable Pharmacy in Columbus.
Oh, okay.
It's the divine economy of abundance. When you ask, it shall be given to you. So when you ask in faith and there's a need and it comes through, that's reassurance and reaffirmation that you're on the right path.
Absolutely, yes.
Could you highlight some of your volunteers, where they're from, who might be one of your steadfast volunteers or a medical director or board members that you would like to give recognition to?
Well, many people know Jennifer Allen, Dr. Jennifer Allen. She's a longtime pediatrician here in Chillicothe. She has been one of our, from the very beginning, she's been with us. But she, when we had found her, you know, at that time she had just had her heart transplant, and she was a few years out, but you know, she loved her job, but she could not do it any longer because of her heart transplant. And she joined our board immediately, her and her husband and Alan, and they have helped us tremendously. Alan was our treasurer for a very long time, and Jennifer has been our board president. But she won't be with us after this year. So we are right now looking for a replacement for her. But Dr. David Smith, longtime physician here in Chillicothe, and he's our medical director. So I'm so thankful for him because he's helped us for so many years from the very beginning also. And him and his wife both have been very committed to Hope Clinic, Camille. We also have Lana Urig, who is from here. She now lives in Atlanta, but she was one of my partners in starting this whole entire thing. We have several specialists. One of your colleagues, Dr. McCallum, she's been with us from the very beginning. She's been very dedicated. She's helped us with many fundraisers. She's been wonderful to have helping. We also have Dr. Olatunde, who's a cardiologist from Adena. He also helps us. He's one of our specialists. He'll see internal med patients and he will see cardiology patients. So he helps us a lot. We also have Dr. Lewis, who is a dermatologist. He has taken care of many skin cancers for us. And Dr. Strock, who is orthopedic specialist, he's helped us with many of our patients from the very beginning. Dr. Lewis and Dr. Strock have been with us from the very beginning. Dr. Seinsticker's been with us from the very beginning to take care of our diabetic patients, our parathyroid, thyroid disease patients. He's helped us a lot with many different things, and he's been with us, been very faithful. And Dr. Shiflett was originally our psychiatrist, but now Dr. Stanfield is our psychiatrist, so we really appreciate them. When I tell other free clinics that we have a psychiatrist, they are very jealous of us because you just don't find that, the big need that you have. And all of these specialists, endocrinology, I mean, we have very committed volunteers, so.
And I know that we were talking about eye care and eye emergencies before,
yes,
as we were getting ready for today's Living Well broadcast. And Dr. Lockwood also has been a partner.
Yes, and he actually, our diabetic patients that have a lot of diabetic complications with their eyes, he's actually been seeing our patients for free for us. Yeah. So it's been wonderful from the very beginning. Yeah,
great. So so if I'm listening to this or watching this on YouTube or Facebook live stream, and I feel the call to help, how does one become a volunteer at the Hope Clinic?
Well, they go online to www.hopeclinicfree.org, and there is an application on there, and you go on and you do the application. We do background checks, and for providers, we have to do a more thorough background check on our providers. And then once they do the application, then they do an online orientation. So do an online orientation, and then we get you scheduled for your first day, and then do a little orientation right there at the clinic.
Okay. So I know that in the divine economy of abundance, if you ask for it and you ask for it specifically, it comes to fruition. What types of volunteers do you need specifically at this moment?
We need providers, we need nurse practitioners, we need doctors. If you have a specialty and you want to see if we can have that at the clinic, most certainly we'll try. We need IT, somebody to help with our computers and that kind of thing. It's very difficult to find people in IT. We need people in social services. We don't currently have anybody working in social services right now, and it would be very nice to have somebody that can help people to navigate the social system. And we need nurses. That's one of our largest needs is nurses, but we also, not just nurses, but MAs, medical assistants. So we need people like that to help out.
Okay, God, you heard it. So expect a miracle in terms of volunteers. Right. The food program. So I'm just overwhelmed by the breadth and the depth of services that you have. So you have a food program that helps people eat healthy, and they learn how to cook healthy
Yes.
to help treat their diabetes. So how, and then there's an overlay of faith and hope. Where does prayer come in for the people who come to Hope Clinic? What role does prayer play?
We have prayer volunteers also. We also need more prayer volunteers. We have prayer volunteers that come in and they pray with people that are in the waiting room. They do a special prayer and a devotional with them. And then we also do a prayer with our volunteers also. We pray for our patients, we pray for the evening, we pray for each other. And then we also have prayer cards that we give to our patients, and they will fill out and say what kind of prayer are they requesting for the evening. We do not force prayer on anybody. If people do not want prayer, that's okay. They do not have to. But we do have prayer. Our prayer volunteers will go into the patients' rooms and they will pray with our patients. So.
Good. I bet that's comforting for many people.
Oh yeah. And when you're scared and you got something medical going on, you're finding out what your test results are, or you're finding out, something, you don't know something's going on, you don't know what it is. It helps a lot to have somebody come in and to pray with you.
So I heard you say that you have sent some of your own patients to the Charitable Pharmacy. And I know that people often will be on very expensive medicines, and then either because of a side effect or some reason they're changed from that medicine, but they have all this very expensive medicine at home.
Yeah.
Are they able to donate that to a charitable pharmacy?
Unfortunately, if it's been opened, we cannot take it because of our level of our pharmacy that we are right now. But we can, if it's unopened, normally we can always take the medication, especially insulins. So, but if it's been opened or been tampered with at all,
Sure.
we cannot.
So if it's a 90 count bottle with the tamper-proof seal still sealed,
Yeah.
that's
Yes.
eligible to be donated.
Yes.
Okay. All right. Wow. You're coming up on 10 years.
Almost 10 years, yes.
What about fundraising? How do you raise funds for the Hope Clinic?
We have different events. We have an amazing fundraising team, and we always need people to help with fundraising too. But we have, every year we always have the Kentucky Derby event, and that's held at the Country Club. We plan on having it this year. It got shut down for a couple of years because of the pandemic, unfortunately, but we are starting that back up. And I think it's beginning of May this year that while Kentucky Derby's going on, we will have a big event there. So we will be selling tickets probably, starting 2 to 3 months beforehand. It's always a fun evening. Yeah. And then we also have, right now we have Christmas cards that we are selling. If you send us a message or call us, or we can get you Christmas cards. We'll deliver them, or you can pick them up at the clinic. And they're 10 for 10. They're actually painted. The front of it is painted by our own artist here in town that does many murals. Pam Kello. She's very gifted. So this year, every year we are doing Christmas cards. We spotlight a different artist every single year.
Oh, that's neat.
So yeah, so a local artist too. So Pam did ours this year. It's a beautiful little lamb, and it has a beautiful verse inside of it. If people are interested in that, they just email us, call us, let us know that they would like those. And another fundraiser that we have coming up is the garden tour. So Josh Detillion is going to be leading that, and downtown homes that have big gardens. We're going to have a garden tour, so that's going to be a lot of fun. We also we had a candy run this year. We used to have the Muddy Leprechaun, but we haven't been able to do the Muddy Leprechaun because of the area we wasn't allowed to come back to because of different laws and stuff that was in place. But we had the candy run. It was so much fun. You got a lot of candy while you were running. So, but we had a good turnout for being back from the pandemic. So every year we're going to be continuing that candy run. We plan on it. Next year, we think that we're going to add on another run also. But you have to watch Facebook for more of that. We also have a fundraiser that's going to be coming up soon, and we're going to be raffling away 2 nights and a lot of different gift cards and things to do downtown Chillicothe for the room at the Carlisle building. So Adena has graciously given us 2 nights that you can stay in a very nice room, suite at the Carlisle building. So we're going to be raffling that away, kind of like around Christmas time. So.
Okay, great. So keep your eyes peeled on social media for that.
Absolutely.
So you're found on Facebook?
Yes.
Are you on Instagram or Twitter or other social media outlets?
I believe it's just Facebook right now. I do not believe we have any other social outlets. We're working on them though.
Okay. All right. So kind of to recap, one of the biggest additions in recent times is now the Community Charitable Pharmacy.
Yes.
And that's open from 4 to 8 each Monday night that the Hope Clinic is open.
Yes.
And you don't have to be a patient of the Hope Clinic to go there. And if I remember right, you're eligible if you're at 300% of the federal poverty level.
Yes.
And for a family of 5, that's $100,000 or in that neighborhood.
Yeah.
So if you're struggling to pay for medicines, especially diabetes care medicines, insulins, there's a solution for you here in Chillicothe.
Yeah. And I don't think we have many medications that are available. I was helping to alphabetize the medications the other night, and I said, is there any medications that we don't have? And I don't think there's any medications we don't have right now. And if your provider wants to send us the prescription, it's under Charitable Pharmacy of Hope Clinic, or they can write a paper prescription and you can bring it to the clinic.
Okay, so we can prescribe it electronically?
Yes, you can prescribe it electronically.
Wow, that's amazing. That's great. So Jamie, thank you so much for your dedication and the ability to listen to God's call and to respond. I often say our job is to be obedient. It's up to God to do the rest. So thank you for being obedient to His call.
My pleasure.
And the impact that you've had on so many people for the last coming up on 10 years. So thank you from a community member, and thank you from a physician whose patients, when they didn't have insurance, you all helped. And it's important that we take care of each other, because the least of us any day we can be in that same position.
Absolutely.
So God bless you and your work and your volunteers, and excellent presentation today. And if you can support, please reach out. What's the phone number again for the Hope Clinic?
It's 740-774-4606.
Okay, so you got that. So, and then you can find them on Facebook, and I bet you there's a way to donate on Facebook. So thank you very much for your time today. I just want to sum up the pediatric vaccination availability. The COVID-19 vaccines, the Pfizer vaccines that are eligible for 5 to 11 years or older, they are now being offered at Adena Pediatrics with same-day appointments, Monday through Friday, 8 a.m. to 7 p.m., and Saturday, 8 a.m. to noon at Adena Pediatrics in the Medical Office Building on the main campus of Adena Regional Medical Center here in Chillicothe. You can also call 779-4300 to schedule an appointment if you're a patient of Adena Pediatrics, or schedule, you can also receive that booster whenever you come in for a well visit or a checkup. So thank you so very much for joining us for this episode of Living Well with Adena, and we look forward to coming again into your homes and onto your devices in the near future. Thank you.